Hi, I'm Mark Einstein. I'm the chair of obstetrics, gynecology, and women's health at New Jersey Medical School. I'm the chief of service of women's health services for University Hospital. At the core of everything that we do is healthcare delivery to our surrounding community, and we wanted to provide the services that are key to our community. Our community includes many LGBTQ identified individuals, and as a result of it, we want to make sure that we are providing those services that are unique to that part of our community as well. Um, LGBTQ identified individuals are at risk for a number of things, including certain types of sexually transmitted infections such as HIV, including some of the behavioral health issues that Dr. Livonis had spoken about. And I know that some of our other colleagues are going to be talking about some of the other health-related issues. One of the things that we've identified over the last 10 years is that individuals that have HIV are at risk for anal cancer. And in fact, the anal cancer risk has tripled in the last 20 years. It has become a priority issue for our National Cancer Institute. And as a result of that, there has been a number of organizations, and in New York State actually now has recommendations for routine anal cancer screening. Now, one would say, whoa, what does that mean? Is this like, what are we doing for this? Well, it's essentially like a pap test for the anus. Okay, and we've established these services at University Hospital over the last couple of years, and this is particularly adversely affecting our LGBTQ individuals. And in fact, about half of the individuals that we see in our high resolution anoscopy clinic are those that identify as LGBTQ individuals. This is the idea is that we want to pick it up at its precancerous state before individuals get cancer. Okay, and we're able to do this within just the simple office setting. Okay, and so far so good. We've been picking this up, and as a result, actually, of the efforts that we have put together, we have actually been notified that we're going to be part of a larger effort that is sponsored by the National Cancer Institute, the Division of Cancer Prevention. The largest funded trial right now for prevention of cancer is actually in anal cancer prevention, particularly in HIV-infected individuals. And we will be one of the sites. We will be one of the 12 sites in the United States that will be a part of this trial. And this is really because of it is a healthcare problem that is affecting our community, and it is really this disturbing trend that is actually happening. So I just wanted to give sort of an example of one of the healthcare services that we provide that is unique as a healthcare service that is because of the unique community that we serve too. Another thing that we have been working on, and this is something that has been a work in progress that is led primarily by our plastics individual, Dr. Keith, who is not with us right now. But Dr. Keith had come to me to talk about, well, how are we going to be working on transgender reassignment? Now, this is the kind of thing that has been publicized in the news by individuals that might have a lot of funds, to be able to do this, because in the past, this has actually been something that has not been paid for by insurance companies. But because of recent changes in sort of how transgender has been looked upon by the psychiatric community, it is now not, shall we say, something that is a mental health illness, but is actually more of a dysphoria. Okay, it is now thought of as I have a dysphoria to the gender that I am in, and as if there is a dysphoria and there is a treatment for that dysphoria, then it actually has to be paid for. And the Center for Medicaid and Medicare Services actually changed its rules, and it is now something that is paid for. All the surgeries that are associated with being in that gender that one might think they shouldn't be in, okay, or have a dysphoria of being in. And as a result of this, we have been one of the leaders in trying to set up a program for gender reassignment surgery. My clinical work is in GYN oncology, and as part of that, we have to do a lot of larger procedures which also require the reconstruction. Oftentimes, we have to remove many of the pelvic organs, including a vagina, and then we have to reconstruct a new one. So those same procedures we actually use for reassignment surgery. The good thing is we're usually dealing with healthy, non-radiated, tissue in these individuals. Dr. Keith has actually gone through extensive training to actually be able to do the microvascular work for the being able to change things around such that people could have feelings with a neoclitoris as well as a neovagina. And so far, we are actually the first institution in the state to have done both male to female, female to male patients so far, and we have many, many more that are in the line of having this surgery to get done. I know that Dr. Keith has, some things that you should be aware of is that we are the first multidisciplinary center that is dedicated to the care of the transgender persons. And this is a multidisciplinary team, not just the surgeons parts of it, but there's the behavioral health parts of it. There's the head and neck. We are able to do actually voice changes too, okay, to help with the gender reassignment surgery. The reproductive endocrinology, as one of our colleagues will be talking about a little later on, but hormones are a major part of the gender reassignment surgery aspects of things. And not everybody goes through the end surgery, okay? Many live their lives transgender, but without necessarily having to complete the bottom surgery, okay? We have top surgery and bottom surgery is how we refer to it. Many complete top surgery, but not everybody completes bottom surgery. That's a much bigger surgery, as one might imagine. So the services do include the primary care aspects of it, which include the hormone therapy, the mental health counseling, because there's a lot of issues with going through these changes, not just from a behavioral health issue, but actually learning how to be a patient. Okay, and that's a unique sort of skill set that patients have to sort of learn because they're otherwise normal, healthy, living their lives, all right? But to go through this is a stepwise process. The voice adjustment procedures, as we talked about, as well as egg preservation that we're able to provide, as many want to eventually have children, okay? And like I said, there's the top surgery and the bottom surgery, and then there's also revision. So one thing we noticed once you start opening up a program, we're getting people that have actually been medical travelers and have had these surgeries in other areas of the world, and they're not from well-trained surgeons, and they're really pretty botched up stuff. And so we're here to help, to revise it, to make it actually right so that they could be functional and live their lives functionally from surgeries that have been done inappropriately, shall we say. All right, so we've actually did our first female to male genital reassignment surgery. That was in February. We've done our first male to female reassignment surgery. That was just last month, okay? And both are very happy, and they were both successful surgeries.